supported the city's request for more funds to fight bed bugs, to battle bed bugs in Toronto. But can you just outline some of the resources? I believe that the city and public health is actually quite engaged and has put resources in to the fight against bed bugs, and that we're kind of alone at this point. Is that not the case?
Well, since the beginning of the bedbug project, Toronto Public Health has committed resources to this issue, including frontline health inspection staff who were taken off other programs in order to respond to complaints of bedbug infestations and to assist in their resolution. We have, through Mr. Ayer's work, up till now co-chaired the bedbug steering committee, which is our way of working with all of the other stakeholders who are concerned in this issue, and who, many of whom have also put resources and time into the issue. We've also had involvement of some of our nursing staff in assessing particularly challenging, vulnerable individuals who have major bedbug infestations. I'm pleased to say that we're starting to see more resources coming from other parts of the city. Anne Longuerre, who's here today, from Shelter Support and Housing, will be taking over the co-chairmanship of the Bedbug Steering Committee. We've seen contributions in kind and of effort from Toronto Employment and Social Services, from Shelter Support and Housing, and of course from the Toronto Community Housing Corporation. So there are more resources coming to the table, although it's not dedicated resources. It's always in kind or taken away from other sources. As the report outlines, although we did not get so far a positive response to our funding request from the provincial government, the province has undertaken to do some work in this area, including the development of educational resources to be used provincially, which I believe will be at least in part based on the resources that we've developed here in Toronto, as well as some work on enhancing a system of bedbug surveillance across the province. We hope that that's just a beginning of what the province may bring to the table to help with this very challenging problem.
It seems that the province is also going to be doing a survey of health units to see where things are at. Would you not agree with me that we have already done our survey, that we are kind of out of the gate on many of these pieces?
Mm-hmm. Well, the province has already done a very brief survey to try and get a sense of where the bedbug issues were across the province, and they certainly found that they were in many jurisdictions other than Toronto, so this is something which is a provincial concern.
But the leading edge work on bed bugs is being done here in the city of Toronto.
I would say, talking to colleagues across the province, that there is certainly much more activity happening here in Toronto. And much of it has been led by Toronto Public Health, but as I say, I'm glad to see there are many other partners at the table at this point.
And a dedicated project coordinator and other staff who are dedicated specifically to bed bugs would give us some great learnings for the rest of the province as well. So this would be money well spent by the provincial government, even in other jurisdictions, even though it will be coming to Toronto.
I agree, and certainly the provincial government is already benefiting from some of the work that we've done in creating bed bug resources and education, for example.
So the money that we'd be asking for, $2.8 million for the 5 years, we are already devoting a fair amount of staff time and money to bed bugs in the city of Toronto. So
yes, we are, and this
would be on top of what we are already.
It would be, and it would also enable us to take some of those resources which have been borrowed from other important activities and get them back doing what they should be doing.
Thank you.